Welcome to Webinar Wednesday. Today's presentation features Sandra Rasmussen, Senior Vice President, North America Sales and Global Marketing of Sonitor Technologies, and Stephanie Anderson, Managing Partner of ZulaFly. Our presenters will demonstrate how RTLS can provide the automation and immediate access of notifications required to ensure the safety and sanity of caregivers. Before we begin, Webinar Wednesday would like to thank you, our attendees. Today's webinar will mark the last webinar for our 2020 series. This year, we've awarded over 6,300 CE certificates to the biomedical and HTM community. It's the continual support of each attendee that has helped make Webinar Wednesday one of the top resources for this industry. Today, we'd like to give one lucky webinar attendee the chance to win a Webinar Wednesday webinar t-shirt by telling us what year Webinar Wednesday began. Answer now using the question feature on your webinar dashboard. Our sponsors today are Sonitor Technologies and ZulaFly. Sonitor's mission is to deliver the most accurate and reliable indoor positioning technology to improve the quality of life. You can learn more about this company by visiting sonitor.com. ZulaFly's goal is to get you up and running on a system built by experts that features ongoing support from experts. Visit zulafly.com for more details. As a note, there is still time to join us at our last HTM Mixer for 2020. Join the Tech Nation and the MD Expo team in Nashville, Tennessee, December 9th and 10th for 2 days of networking, education, and fun. Visit nashville.htmmixer.com for details. Today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey. We will wrap up today's presentation with a live Q&A. You can submit your questions anytime during the webinar by using the question feature on your webinar dashboard. We'll get through as many attendee questions as time allows. Sandra, we want to go ahead and start the presentation today, so you may begin whenever you're ready.
Thanks, Jamie, and welcome everyone. We're excited to be here today to talk to you about solutions that can really help keep staff safe and sane, especially as we start thinking about the incredible stress that our healthcare workers are facing these days. Jamie has already introduced the speakers, so I won't take any more time to do that. And she has already taken the opportunity to share with you what Sonitor's mission is. We are the leading provider and innovator of ultrasound-based RTLS, and as many of you know, RTLS is used in many healthcare facilities to enable a wide variety of use cases, and these use cases can really play a significant role in helping to provide caregivers with much needed time to be able to spend with patients to ensure that they're able to give the highest and the best quality of care. Today, we're really going to focus on staff safety and workflow automation and efficiency solutions that can also help reduce stress, increase productivity, and, as we say, provide that level of sanity back to healthcare professionals. Before we get started, we really want to take the opportunity to thank all essential workers participating in our seminar today for the selfless work that you do to ensure that your patients are well cared for and safe. We really appreciate your commitment and dedication. We do recognize that you are the most valuable asset that your facility has. And with that recognition, we're also aware of how hazardous hospitals are becoming as a place to work. And a lot of that is due to the nature of the environment where fast decisions need to be made. And as a result of that, often the workplace also cannot be very efficient. Sharing with you on this slide some statistics and data that's really relevant to staff safety and staff sanity. There's over $2 billion that gets spent in healthcare as a result of missed days of work and legal expenses due to workman's comp as a result of workplace injuries. More than 50% healthcare workers communicate that they've been victims of workplace violence. There's hundreds of thousands of dollars of cost that's incurred if a nurse or caregiver needs to be replaced as a result of injuries. And there's so many inefficiencies in terms of caregivers' average workday, just trying to find equipment that's suitable for taking care of their patients. So when you think about all of that and look at some of the daunting statistics that are associated with the healthcare environment and what causes injury or risk to healthcare workers, nearly 50% of injuries are due to overexertion, so whether that's lifting or moving a patient, 25% due to fall hazards, running from one place to another, trying to either find equipment or to get to a patient to help them as quickly as possible. 10% is due to workplace violence, and that's as a result of interactions potentially with patients, visitors, family members, and unfortunately even other employees. And the remainder is due to infectious diseases and proximity to contagious patients or even contaminated equipment. And that's surely top of mind as we think about COVID and how we're all managing through that environment today. So how do we start thinking about solutions that can help? It's clear that automated and interconnected tools can help improve safety and efficiency, and therefore the sanity of healthcare workers and their environment. And the term medical Internet of Things is becoming very common, so we thought it'd be helpful if we shared what we think can be a common definition of the medical Internet of Things. And so as you think about that, it really is just devices and applications specifically for healthcare, such as sensors and software, that can connect and exchange data with other devices and systems leveraging the internet. And medical Internet of Things can help improve patient outcomes because it gives you that access to real-time monitoring of information. And it can also help manage the inherent complexity of healthcare through automation, safety, and other technology gains. And so RTLS can play a significant role and be a component of the medical Internet of Things. RTLS solutions can connect and share data with other systems such as EMR, nurse call, etc., and that can help improve the overall healthcare environment. So what I tried to do on this slide, just as a refresher and primer, many of you probably know what RTLS is, but just so that we're all sort of on the same page and level set, an RTLS solution is a real-time location system, and it allows us to provide location and activity-based information on people, such as patients or staff, and on assets. It's typically indoors, and it gives you real-time information. So it's an active tracking solution. Wearables are involved, so patients and or staff will wear either a tag or a badge, and then tags are affixed to medical equipment such as IV pumps, chairs, wheelchairs, beds, etc. There are a variety of RTLS technologies out on the market. We'll talk a little bit about all of them. Sonitor develops ultrasound-based RTLS. So for the purpose of this discussion, when I talk about the solution and the activities, it's based on our experience and installations and proven performance that we have as a result of ultrasound. Depending on the technology and the use case, the accuracy of locationing can vary, but you can get zone, room, sub-room, bay or bed level accuracy, and you get that with context. So it's where something is relative to either a person or a thing, how long they've been there, and what their movement is from one location to another. In addition, RTLS solutions are also supported by activity-based button presses that can be programmable and can help designate if assistance is needed or initiate a workflow or determine the disposition of an asset, for example, whether it's clean or soiled. As I said, there are a variety of RTLS technologies, and not all of them behave or function in the same way. And the performance of a given RTLS technology really is dependent on the core positioning technology that's used. Sonitor uses ultrasound as its core positioning technologies, and for use cases where accuracy is critically important, or in the case of staff safety, your life depends on it, as we're discussing today, you really need to think about the highest level of accuracy that you can get. You need to know where that person is in the moment so that help can get to them immediately. So in the next couple of slides, we'll talk specifically about the use cases and how they work and how RTLS can support the specific activities that we're talking about. Because my familiarity is with Sonitor, I'm going to talk briefly about how the Sonitor technology works in the context of the use cases that we're talking about. So as I said, it's an ultrasound-based solution. And in order for an RTLS solution to work, the infrastructure is installed in every patient room and throughout the rest of the facility to meet the accuracy requirements. So if you need room level, you need a location transmitter in each room. If you need bay or bed level, the configuration of location transmitters would be designed to support that level of accuracy. In addition, staff and patients are assigned unique and individual badges that are worn on either clips or, in the case of a patient, on the wrist. And then for medical equipment, tags are affixed to the asset. So things like infusion pumps, wheelchairs, beds, etc. As a result of the location transmitter in every room, a unique location-based signal is sent every second from the location transmitter to the tags. The tags receive that signal, and then they communicate over the Wi-Fi. And then as people and equipment with badges and tags move, their location is updated as a result of the tag picking up a new location within 1 to 3 seconds. So everything can be accurately tracked and monitored. And because in scenarios where patients' tags and assets are all tagged, you can imagine that every interaction and all of the activities based on their movement and location can be captured. And then that information is sent through an integration to ZulaFly, and Stephanie will talk about the ZulaFly capabilities in the next section, where reports can be generated and real-time information can easily be visualized. So when we start thinking about staff safety and helping to improve efficiencies and productivity, what sorts of things are needed? So you need an RTLS solution that, from a staff safety standpoint, can provide immediate and accurate access to help if a staff member is feeling threatened. You want to be able to facilitate staff assist and collaboration, automate contact tracing so that you can minimize the spread of infection, ensure that quick and easy access is available to find the right equipment at the right time, automate things like temperature monitoring. It's going to become especially critical as we start thinking about these new vaccines that are readily becoming available. And certainly we want to think about improving efficiency and workflow. So I'm going to walk through these individually just to provide a little more color for each. With an RTLS-enabled facility, with staff having individual badges, immediate help if a staff member is feeling threatened is just a button press away. So when a staff member is enabled with an RTLS badge and they feel threatened, they can press a button and that will send their exact location out through communication to a variety of devices that can then alert the appropriate emergency responders exactly where they are so that they can get to them as quickly as possible. And I can give you an example at an installation at MedStar Harbor Health. The staff there have really found it and have proven it to be helpful, and it's now mandatory for all staff to wear badges. It's really saved lives and given a high level of confidence to the staff members that they can get access to help as immediately as needed. If you think about a scenario without wearing a badge that gives you that easy access button press, a staff member would have to try to locate a stationary e-call button in a room or a hallway, obviously assuming they can get to it and wasting precious time. And that act of trying to get to a call button could also result in escalating whatever the threatening situation is. The ability to have that instant access provides a level of confidence, but it also ensures that someone is going to get to the exact location of the caregiver immediately. And that's why accuracy of a system is so critical in scenarios. You want to make sure that when that button is pressed, the exact location and not an adjoining room or potentially some other location on that floor is being communicated. And with ultrasound, you really get down to that room level location. When a staff member presses a button on one of our badges, a message is sent every 2 seconds until that message is manually disabled. So it really ensures that there's no break in communication until someone gets to the caregiver in their time of need. The second example I'm going to give is on staff assist and collaboration. As I mentioned, 48% of injuries are related to exertion. Simple things like turning a patient over can cause an injury, and studies show that caregivers experience something like 7 times higher musculoskeletal disorders than what is the national average for other occupations. So when an RTLS solution is enabled, caregivers that are wearing a Sonitor tag can simply press the button and have someone that is close in proximity to them get there to help them assist the patient in any way. So in this example, let's assume a nurse needs assistance turning a patient. If there's no RTLS, then the nurse presses probably the patient pillow button, setting off the room alarm with multiple people responding, or maybe no one responding because everyone thinks that somebody else is responding. via the intercom, and that can also cause alarm fatigue. When there's an RTLS-enabled solution, the nurse presses a button on her personal tag. The alert can be programmed to go to certain people, so it can be role-based or even the closest person, and there's no audible alarm required. So that really also helps with alarm fatigue. So in this scenario where the green circle is, that's the nurse that needs help. She presses her button. It gets communicated to potentially this person at the nursing station versus the staff members that is, on the other side of the unit. As equally important these days is the ability to automate contact tracing, especially as we start thinking about infection control and the ability to really monitor and manage an infection if it should take place in either a unit or a department. And as we all know, increasing amount of hospital staff are becoming exposed to COVID. So RTLS can help automate contact tracing, which ultimately then minimizes the spread and can help quickly and efficiently isolate and identify any staff, patients, or equipment that might have been exposed. So if you have an RTLS-enabled facility, there's a location transmitter designated up here by this in the ceiling with a caregiver wearing a tag, a patient wearing a tag, and equipment such as the bed here also being tagged. So if at some point it's identified that this caregiver has been infected with COVID, the facility can easily go through their records and through reporting capabilities through ZulaFly, can run contact tracing reports and identify who else this caregiver may have been in contact with, what rooms they may have been in, which patients they've interacted with, and what equipment they also may have been in contact with. This allows the facility to very quickly take action and make sure that they're minimizing the spread and communicating appropriately to those people that need to have that information. Giving access to the right equipment at the right time can also help improve productivity and reduce the stress on caregivers. RTLS has been shown to save up to 40 hours per month of caregiver time searching for equipment. It can also help minimize injury if you think about a caregiver needing immediate access to a piece of equipment and running through the department to try to find something versus being able to very quickly on a dashboard look up what equipment is available, but also is not just available, but is also clean. So in this scenario, we've got a nurse with a patient. She can look at her mobile device and not only see where equipment is, but also see where the closest piece of equipment is so that she can get access to it immediately. And Stephanie will also talk a little bit more about other functionality for tracking and monitoring the disposition of equipment and understanding par levels as well as location. This obviously can help save a lot of time for caregivers, but in addition to time, the ability to really understand the disposition of a piece of equipment can also help save money in terms of maintenance and potentially any fines or risks or penalties associated with equipment that may not be up to date in terms of maintenance. I want to also talk a little bit about temperature monitoring as both something that can help in automated temperature monitoring that can help improve productivity, but also something that can help significantly save money or at least minimize the risk of large costs associated with freezers and refrigerators malfunctioning. So there's so many reasons to really ensure that environmental conditions are maintained throughout your facility, whether that's the OR or if we're looking specifically at freezers and refrigerators. If you think about how much time is spent monitoring and ensuring that these units are maintaining their temperatures, if we even just think about refrigerators, it's, something on the order of perhaps 30 minutes a day across a unit or a floor. That gives you 3.5 hours a week, and can really add up to a lot of time per year. That doesn't just result in wasted time, but it can also result in lots of compromised inventory, and as a result of that, lots of money spent or lost as a result of failed inventory. So manual processes, units are checked once a shift or maybe every 12 hours. But if you think about things like blood can spoil in less than 30 minutes. So if a unit, a refrigerator goes down or a freezer goes down in between checks, that spoilage cost can easily range from $100,000 to $500,000. And with these new vaccines that really require special environmental conditions, ensuring that the storage units are maintaining the right temperatures is going to be critical. So in addition to saving time by not having to have someone manually check the temperature, significant dollars can also be saved. And in this use case, a temperature tag is installed in each of the freezers or refrigerators. Then appropriate thresholds are set depending on what's being stored in the particular unit. And if those units go out of that threshold temperature range at any given time, then alerts can be sent. And since the facility is RTLS enabled, the exact location of the down unit can easily be identified, and then immediate action can be taken. And so that really can help save a lot of money in the event that a freezer goes down, and it can also save a lot of the medications and vaccines, etc. And then just lastly, as we're talking about staff safety and sanity, an RTLS-enabled environment can help automate a number of other workflows that can significantly save staff time and effort that then allows them to really focus on providing that high quality care. So whether it's the ability to automatically be notified or automatically be able to visualize when rounding events need to happen to visit a patient, thresholds can be set and dashboards can be established to give a yellow, red, green indicator. Green indicating that no rounding is necessary, yellow indicating that rounding should be occurring, and red indicating that the rounding time has passed and someone needs to get in there. RTLS can also enable nurse call automation, so it can help reduce even more alarm fatigue if a patient is calling for a nurse. The action of walking into the patient's room, since the facility is RTLS enabled, will help cancel that nurse call without having to distract the caregiver to move over to a wall mounted unit and to press a button to cancel a call. And then things like automated bed management solutions can also be enabled if a patient has been discharged and that discharge process is enabled by RTLS, such as taking the tag off the patient and depositing it in a discharge bin, that can automatically trigger a series of events to the facilities and the environmental team that that patient room is now empty because the patient's been discharged. The team can get in to clean it, and it will automatically be recorded such that that bed can now be made available for the next or for a new patient. So in summary, an RTLS-enabled facility can really significantly contribute to ensuring staff safety and also providing a variety of automation and tools that help increase efficiency, workflow, productivity, and ultimately can really deliver significant value back to the facility. Sonitor's RTLS solution is an open integration platform, which means that it has the ability to interface and interact with a variety of solutions and to support a variety of use cases. And once a facility has made the investment to install an RTLS solution for one use case, it's very simple to add additional use cases on top of that by providing additional tags to either staff members or by tagging assets that really allow the facility to leverage the investment made in RTLS and to continue to grow from a use case standpoint and to continue to add value to their facility through RTLS enablement. As I mentioned, this data gets fed in to the ZulaFly software, which can then provide reports, dashboards, and visualization to the caregivers or to the relevant people that need the information. So with that, I'd like to hand it over to Stephanie so that she can share the software solution platform and continue our discussion.
Perfect, thanks, Sandra. So let me pull up here our my screen so you can take a look at it. So now that we've collected all of this valuable location data, what do we do with it? How do we make it actionable? So this is where ZulaFly comes in. We take in all of that location data from Sonitor, and we essentially make it meaningful. We apply names to the tag IDs. We provide location names. We trigger alerts based on predefined activities such as staff duress. We provide information on easy to read dashboards that we're going to take a look at. And then we also provide the analytics. So real-time reporting along with historical reporting as well. So during the next 15 to 20 minutes or so, what we're going to talk about is the applications that we offer, take a look at the dashboards as well, so you get a feel for what the solution and application looks like, and then we'll wrap up with some differentiators. So let's start out with the applications that we offer, and we're going to speak to all of these and how they tie into helping with the staff duress and the staff sanity aspect of it that we're really looking to help with and accomplish. So mobility is a part of that application that we provide access to those applications on really any device that staff may be using. It helps so that when they're moving around and trying to do all of the tasks that are on their list, we really give them quick and easy access. So we'll talk through asset management, staff safety, temperature or environmental monitoring, and workflow. We'll talk about workflow today in terms specifically around patients, but workflow truly can be anything, whether that is staff or assets as well. So let's dive into the dashboards. This is our map dashboard, and where this really becomes valuable is we take in PDF, JPEG, different file formats of maps of your facility. The key piece of this is the enterprise solution. Security or any of the others that are looking at a map view, you can view multiple buildings, multiple floors or departments of those buildings, up to 4, within a single dashboard. And the goal of that is really to eliminate a lot of the constant clicking around. So if there are specific departments, maybe a behavioral health department that you really do want to keep an eye on, that may be one of the departments that you do keep within this dashboard. But very easy to toggle between buildings, floors, and then you'll also notice there's a search underneath the floor 1 drop down, or the floor drop down in the top left. That also allows for easy search within that map view or within that floor. You'll also notice that one of the icons is red, and it also has the red box around it and has risen to the top of the left-hand legend. This really helps from a visual perspective with a staff duress alert. Maybe it's a piece of equipment that's walking out the building, but the map visual, it shows red and rises to the left of the top hand, or to the top of the legend. You also will see icons move across the map in real time. Sandra spoke a lot about the accuracy, and she is spot on. We've worked with Sonitor for many years, 10 plus years, and their location accuracy, absolutely, it is spot on. Where the location tells you that it is, that tag absolutely is there. It becomes extremely important not only with staff duress, but when we get into talking about contact tracing reports and understanding those different encounters or interactions that are going on. So around staff safety and staff assist in particular, if we take a look at the top half of this dashboard, a name truly can be anything that's unique. It can be the full name like we've displayed here. It can be initials. It could also be an employee ID. So from an HR perspective, it really is the comfort level of that facility and what they would like to display. You'll also notice that we show location, time and location, and then also a type or role. You can customize the view that you see. So if there's different information you would like to display with your staff, maybe department, that one is very common, or a different building if you've got a large campus. You also can add different columns or fields to this view as well. The bottom half of this dashboard talks about notifications, and this is really one of the key pieces of the platform that we offer, along with the rules engine and sending out alerts. So as Sandra mentioned, you can program the buttons on the staff tag, and this becomes really important because there might be different, or typically there are different roles within a facility that need to reach out to a different group for help depending on their roles and responsibility. So we can program those buttons to send alerts or notifications to whoever they need to. The nice piece that becomes extremely important with staff safety is that the alerts have unlimited escalations. That basically ensures that it will continue to alert at a time frame that you choose until somebody does resolve or assist and close that alert. You'll also notice on the bottom, the ones that are in this particular screenshot are a priority too. You can choose to set up different priorities based on what that request for help is. You can also choose how often they repeat or send out that alert or notification. There's also a long list of very annoying noises that we offer. Depending on what they are, we do see a lot of facilities utilize those in case somebody is not looking at the screen specifically. That noise alerts them to that somebody is in need of assistance. There's also location history and alert history reports. So what that helps us with is it really provides the details behind who's calling for help, how many times are our staff requesting help, are there different departments that we see a lot of staff requests for assistance coming from, and then most importantly, what is our response time? It really can help drive some good efficiencies and some operational business decisions. Contact tracing. So this, of course, being one of the most important, or if not the most important topic that we've all talked about for a number of months now. This is where too the location accuracy I'd mentioned becomes extremely important. The very top screenshot is our contact tracing report. One of the things that's really important about that report is every customer, when they go to run that report, can choose how long the time frame of the interaction is that makes it relevant to us. So I can choose from seconds, minutes, hours, days, and by choosing and filtering that information, I really specifically hone in on the time frame that somebody that may be infected was spending with others. So I don't have to do any additional manipulation. I choose exactly that 5-minute time frame or 10. And this will come back with all of the interactions, where at, and how long. Now, this also can include assets. So if you are tracking or locating assets within your facility, assets will be a part of this as well. So you'll know if there's equipment that needs to be cleaned. The middle screenshot, looking at capacity levels, one of the topics we've been asked about quite a bit is understanding social distancing, but more so from a perspective of staff congregating in locations. So what we can do is set up basically capacity levels and understand the minimum and maximum that can be in that location while still social distancing. The colors will change based on above or below, and you can also set up alerts to be sent out if you'd like. We have a lot that are simply using this just as a visual indicator, and then we have others that do want the alerts sent out to really help understand if staff are following the protocol that they have put in place. The bottom is a nice trending chart. So when we think about capacity levels or social distancing alerts or staff assist alerts, this report can show and provide trends. So are we heading in the correct direction with social distancing? Do we seem to have a lot of requests for staff assistance over the weekends or on Mondays that maybe we need to look at staffing levels? So there's some nice analytics behind all of the data then that we collect from a staff perspective that you can utilize to help make some decisions there as well. Along with all location history reports. So if there's incidents that occur, all of the reports are there and all of the data is available very quickly for anyone to be able to get access to. Environmental or temperature monitoring. As we get close to or have COVID vaccines that are really nearing final stages or are in final stages, we really need to make sure that we're providing a temperature monitoring solution that automatically monitors the temperature. And there are strict guidelines around what those temperatures need to be. It's surprising still how many facilities do keep track of that manually, and staff are beyond busy. And so this way, when temperature is automatically collected for them, it will send out the alert. This way, all of the corrective action is done automatically, any compliance monitoring. And then because there's unlimited escalations as well, we do know that the system will continue to alert until staff do respond and take a look at that fridge or freezer. So the last couple of applications are really to help with the staff sanity aspect that we've talked about today. And around patient workflow, I took one screenshot of one of the dashboards that we provide, and this really shows the real-time location of patients and where they're at. And as they're moving through different rooms or areas based on the workflow that they may be here for today. Maybe it's a same-day surgery and we need to know where they're at right now. We can always in real time take a look at this dashboard, and whether it be the color of that particular phase of care column, we know exactly where that patient is at, any staff that may be with them. We can also utilize the room state board on the bottom to know where I as a staff member need to be. or my next room that I need to attend to or visit. We also know that families sometimes get irritable with understanding where their family members are at. I feel like they've been in surgery a really long time. Should they be in recovery soon? And this real-time view of where they are, how long they've been there, can help provide and ease some of that anxiety. And also when staff have easy access to this, it makes it an easier conversation, I feel like, as well. Asset management. So Sandra spoke to this too a little bit around the ability to locate equipment. And the whole goal is so that staff are not spending as much time or hardly any time walking around looking for equipment that they need. So now that it's got a real-time locating tag on it, you'll notice that in all of the screenshots that I've shown, up in the top right is a search bar. And you can search in there, put in pump for IV pump, anything that you need to, a staff name. It will pull up the search results. It will show you their location, how long they've been in that location, and in the case of equipment, if it's available. It really is to eliminate a lot of the extra steps and time that we see staff spending in a shift looking for equipment. And two, it's a great time saver for those in biomed that might be at the other end of the call. When staff are looking for something, they really quick can search as well and find what needs to be. So we've talked about notifications and we think about staff duress and staff safety. The big things, we can integrate with any communication device. So we will talk through with our customers for certain alerts and who do you want to receive them? Are there escalations? What's the escalation pattern? And what device do you use? So these can be sent to anyone internally or externally. We talked about, levels of different priorities, and you can see those here in the screenshot. It always will provide the exact location. That becomes extremely important that that's accurate for so many reasons that we've already talked about. And then depending on how you've chosen to display staff name, but it also will tell you who is requesting help. You can also customize the verbiage that you receive in this message. So we want to make sure that what staff receive is extremely self-explanatory as to the action that needs to be taken. So we've talked a little bit too about nurse call integration in particular, but I wanted to spend just a minute on this slide. One of the big differentiators that ZulaFly provides is our platform. Where that becomes really important is the ability to take in data from multiple systems. So within the dashboards that we provide, you really can show any information, display information, run reports on, and provide alerts. So typically, very common customers, once we've talked through the different applications that we offer and we've designed phases for implementation, they also will ask about different systems we can integrate with so that staff aren't constantly jumping between. So are there integrations that make sense that can make staff task lives easier as they're going about their day-to-day operations? Nurse call is extremely common. I don't know if you noticed in the map view that I showed, there were pull cord icons that are on there. Those as well will show red if somebody does pull a pull cord. The automatic nurse call cancellation does then happen when the staff walks into that location. So nurse call common, EMR from a patient workflow perspective. Capital asset management, or the CMMS system, is another one. So the platform flexibility is huge. It's extremely important when we talk about integrations. And last but not least, I get asked this quite frequently, so it's just simpler to put them all on a slide for everyone to see. So what are the differentiators? RTLS has been around for a number of years, so what makes us different, and why is ZulaFly potentially a better fit compared to other systems that you might be looking at. The power of the platform. I put that as the first one because that absolutely is a differentiator. We designed our platform and database to handle not only large transaction sets, but we created our own rules engine. So we've been in this space for a number of years and had a really good understanding of what customers are looking for and what their expectations are. You're putting in an RTLS system to make that data actionable. And in order to make that data actionable, it has to proactively notify our staff. And how do we do that? And that's to set up rules and alerts to help with that piece of it. So the power of the platform is absolutely huge. Each customer implementation is customizable, and that piece makes it really feel as if it's your own. There aren't fields that we hard code that you have to have. It's your verbiage as a facility. So we will work with you to understand what are the columns that you would like to display that make sense to your staff. This really helps with ramp up time. Staff understand what those fields mean. It's a huge differentiator for us. All applications in a single user interface. So when we looked at the first slide and it was the pie with the different applications, all of those are located within a single dashboard. Customers typically may start with one of them and then will continue to add on. So as a customer continues to grow, we add back those dashboards, making it very simple for them. The reports that correlate then get added back as well. So one login, they get absolutely everything. The ability to integrate and consume data from multiple vendors and applications. This ties into the power of the platform, but that absolutely is one of the keys to a successful deployment and taking advantage of the data that's in the database. The non-industry specific, we focused on healthcare today. The same applications do apply, and we do see customers using them across multiple industries. As we are all heading back to work, office buildings has become very popular, education, etc. The customizable dashboards. So based on my role within the facility, I can easily configure the dashboard to see the information that I want to see. It is not a one size fits all. And that is one thing, especially around the alerts, patient workflow, we've seen as a huge advantage to our customers that those folks just look at the rooms they're taking care of. Biomed can look at the dashboards that just pertain to PAR level. Those within security may look at just the open notifications. So there's a lot of advantage to being able to have your view so that you're not clicking around trying to find what you need to. And the last bullet is we do offer a cloud hosted or on-premise solution. We do see a lot of customers choose the cloud hosted deployment in that model, but the on-site is absolutely an option, and we have customers using that as well. So with that, Jamie, I will turn it back over to you for question and answer.
Awesome. Thank you so much, Stephanie. I enjoyed that presentation from you and Sandra. And while you were both presenting, we did receive a couple of attendee questions that I want to get to. Just a quick reminder to all attendees, you can still submit your questions for the Q&A. Please use the question feature on your webinar dashboard. If we're not able to get to your question, I'm going to send it to our presenters today. They'll follow up with you offline. With that said, Sandra, the first question is, how quickly can the solution be deployed?
Thanks, Jamie. Well, obviously, that's going to depend on how large the facility is. But I will say that definitely one of the benefits and part of the value proposition of Sonitor is that it is easily deployable and scalable. Because we have battery-operated devices, it's easy to retrofit, if you will, into an existing facility. So, you know, a unit could be done in a matter of a day to a couple of days. So you can just think about scaling up from that. So it really is dependent on obviously the size and the complexity, but for simple deployments, anywhere from a day to a couple of days to a week to 2 weeks, depending on how large the facility is.
And from a software perspective, the nice piece for us is that we don't require that anyone is on site for any configuration or testing. We can do all of that remotely. So we can set up customers from here, get all of the information that we need imported, and get folks up and going pretty quickly as well. So we usually do all of that while the hardware is getting installed, so that both of those items are taking place in tandem.
Wonderful. Sandra, the next question, I love this one. I didn't even know it was an option, but can the buttons on the staff badge be programmed?
They can. So those can be programmed to designate a specific function, and they can also be programmed to communicate in a certain way to a certain person. So there's, on each tag, there's anywhere between 1 and 2 buttons, and you can therefore program on a 1-button tag the button to either communicate, I need help, and it's not a threatening situation, I just need someone to come help me with a patient. Or you can program the button to say, I'm in a threatened situation, I need immediate help, and that will trigger a more frequent alert being sent. And I think Stephanie described that also. And then on the 2-button tags, there are up to 3 different customizations that can occur from a button press. So whether it's a button press A, a button press B, or pressing both buttons at the same time, each of those can define a specific action.
And I have nothing to add. That was spot on. Perfect. Thanks, Sandra.
Thanks, Stephanie. Last question that we have to make the 60-minute mark. Can staff alerts be sent to any device?
Do you want me to speak to that one since we handle the integration, Sandra? Yeah, so any device, internally, externally, where the folks are located doesn't make any difference. We don't by any means require customers to rip and replace a communication program that they're using. So any device that's currently being used, and facilities typically use more than one, not an issue at all. We can send the alerts to any of those.
Perfect. We do still have quite a few questions. So ladies, if it's okay, I'm going to send them to you offline with the attendees' contact information so you can follow up with them offline. Sound good?
Yes. Yep, that's perfect. Well, we'll coordinate together.
Good. I do want to thank you both again, Sandra and Stephanie. This was a great presentation. I'm excited that our 2020 Webinar Wednesday series ended with such a wonderful presentation. I do want to encourage our attendees to visit today's sponsors. Please do visit ZulaFly.com and Sonitor.com. A quick reminder, you can obtain your CE certificate by completing the post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive the 1 CE credit from the ACI, and you'll be able to download your certificate directly from your computer once you submit the survey. If you have any questions along the way, you can reach out to us at webinar@mdpublishing.com, and I hope that you'll all check the website for our upcoming 2021 Webinar Wednesday series. This will be the 7th year of Webinar Wednesday. You can find more information at webinarwednesday.live. Thanks so much, everyone. Y'all enjoy the rest of your afternoon. See you back soon.
Thank you.